New concern after the first coronavirus death was reported outside of Asia. A Chinese tourist from Hubei province has now died weeks after being hospitalized in Paris in late January. Let me bring in Dr. Jennifer Caudle. She's a board-certified family medicine physician, and there's so much here to talk about. Jennifer, let's just start with that latest development, the first reported death outside Asia. How significant is that?
I think it's very significant, and it's sort of representative of really what we're seeing every day that we wake up. You know, we wake up in the morning and we wake up to new reports of deaths every single morning that have happened overnight or over the last 24 hours, as well as cases. And I think that's representative of really what we're seeing, that this is still happening. This is still spreading, and it's sort of spreading wider in many cases.
Yeah, and now there's at least an effort to go in and try to gather more information to really wrap our arms around what's happening with the World Health Organization.
That's
sending
right.
in their team. We've been told they're going to review data, conduct workshops, and make some field visits. What might we learn from this investigation?
Well, I'm hoping we'll learn a lot. And you're right, the World Health Organization, this was a press conference, their teleconference yesterday that they announced this. They're sending 12 international scientists. They have not revealed the names or the nationalities of the scientists that are going over there to work with Chinese officials to learn more about exactly what's happening on the ground, to try to learn more about the virus, about spread, about really anything we can learn. Because right now, one of the problems with this, we keep calling it a novel virus. We call it novel because it's new. That's the problem here. It's the reason why every day we wake up and we're finding new information, is because this is a brand new virus that we are just every day learning more and more information about.
What about this idea that the CDC has not been allowed into China? The CDC says it's offered its resources, its experts to go in and help with trying to figure out what's going on here, but that offer hasn't been, accepted by the Chinese.
Yeah, certainly to our knowledge, that seems to be the case. And what I'll say about that is, as a physician who's literally on the ground, and I was seeing patients, what day is today? Saturday. I was seeing patients yesterday, the day before. They're asking me about these questions. They're asking about this. People want to know. We need to know as a society. My hope as a physician is that all organizations are working with China. We're working together internationally. That's really the only way we're going to get this taken care of and get this sort of squelched. Because as I mentioned, your first question was, what is the significance of the first death outside of China? We're seeing this kind of spread. And there have been some reports or some claims that coronavirus, or COVID-19, which is what we're calling it, may die down as the weather gets warmer. By the way, we don't know that that's the case. There's so much we don't know. We need literally all hands on deck. I'm glad the World Health Organization researchers are heading over there, but I want as much manpower as we can get.
One of the other concerns is there's not a vaccine.
That's right.
Because we don't know
there's not a medication
the
to treat it either.
Do you have an idea of when we might have a vaccine for this? So
the good thing is that there literally seems to be a race to find a cure, or a preventive measure such as a vaccine. Scientists have been, and there's been reports in the New York Times and other publications talking about scientists who are looking at other patterns of viruses and vaccines that maybe we've come up with, things that we've looked at for Ebola and other viruses in the past, to see, can we utilize information we already have to find a vaccine. Vaccines don't happen overnight, though. It takes a while. We have to do trials, we have to do testing. But the hope, however, is that if scientists are able to use existing information that we have from other viruses that we've worked on vaccines for before, maybe it will put us out front a little bit faster and a little bit more ahead than we would be, like if we're starting from scratch.
And I just want to make sure we have perspective here.
That's right.
It's important to remind us about the flu and what's happening with that. This country alone has now 26 million people who've had the flu. 14,000 people have died from it this flu season. Many of them are kids. How worried should the average American be given these flu numbers when it comes to coronavirus?
Right. So the risk in this country is still deemed to be low. Okay, that is the risk. That's one of the reasons why the CDC does not recommend that we wear masks, for example. By the way, wearing masks in this country is not recommended. So everyone who's going out there buying masks from Amazon and other places, we need to save them for those who need them. So right now, that's not the case. The risk is low. The risk, however, for the flu is through the roof. Honestly, I diagnosed 2 cases of the flu last week, and I'm only in the office a couple days a week. And not only is this a flu season that we're still in, it's a bad flu season. Scientists are saying that this flu season mimics some of the really bad seasons we've had in the last few years. Guys, it's still not too late to get our flu shots.
That's the point.
The hand hygiene, washing our hands, staying home when we're sick, not being around others who are sick. And by the way, those preventative tips are also important for coronavirus prevention as well.
Good information as always. Thank you so much, Dr. Caudle, for being here.
Thank you.